Welcome back to Patient Advocacy Initiatives, a nonprofit educational organization. I'm Dr. Michael Warner, here to help you be your own best patient advocate. In the fifth of our series, we address why would your medical provider want you to complete a prehistory? Well, I can tell you, if your medical provider has not been trained in accepting a prehistory, there's a good chance he or she will feel completely overburdened should you walk in with our book and with a prehistory. But there's benefits. There's benefits that come to less work, better mindset, federal law, and documentation. The evaluation and management of a face-to-face encounter between a provider and a patient requires three key components. They include history, exam, and medical decision-making. If the patient's a new patient, then all three are required. And if the person's an established patient, meaning someone you've already seen in the office before, then only two of these three need to be done. So potentially, if the patient does the history, you can reduce a new patient encounter by 30% work, and you can reduce an established patient by 50%. Now, in all reality, the doctor's going to want to take your information and then dig deeper. Under the current system, though, the doctor asks you questions and probably will spend the majority of the discussion time hitting basic questions like, when did it start? What makes it better? What makes it worse? You could have done these in advance. Better mindset. See, what the doctor's trying to do is he or she is trying to make a medical case out of your story and take your story and formulate it into a medical case so that the appropriate examination can be done and then medical decision-making can be made. By you formulating your patient story with details in accordance with billing and coding rules and also with the structured elements within your electronic health record, you can give this information so that your doctor can immediately engage with you at a higher level of function. Federal law. HIPAA, the Health Insurance Portability and Accountability Act of 1996, already gave you federal right to view and amend your record. And the Patient Self-Determination Act from 1990, that you may know from its Advanced Care Directive, actually promoted you to be able to facilitate your care. Documentation. That may be the best one. You know, they say in a medical record, if it wasn't documented, it wasn't done. So why not tell all of your details? Why not have them in writing? Why not get them documented from a prehistory into the history section of your electronic health record? We're now well into our second week of doing a research study approved by the Office of Research Administration by Conemaugh Duke LifePoint. And we've been accepting prehistories. Less work, better mindset, accommodating federal law, and the documentation is really nice. I encourage you to follow us more on patientadvocacyinitiatives.org, friend us on Facebook and look for discussions, and also, for more information, you can follow our guidebook, Rise of the Patient Advocate, Healthcare in the Digital Age, on Amazon.com. Thank you very much.